State health officials are breaking with new federal vaccine guidance after a controversial decision by the CDC's Advisory Committee on Immunization Practices, or ACIP. In an 8-3 vote on Friday, the committee recommended ending the universal birth dose of the hepatitis B vaccine for babies whose mothers test negative, reversing more than 30 years of a public health practice credited with driving infections in children down 99%, and instead recommend delaying it until a child is 2 months old, while also recommending individual decision-making in consultation with a doctor. Within hours, the state health department issued an executive directive protecting the birth dose, saying delaying it would weaken the state's ability to prevent dangerous, lifelong liver disease. For more, we turn to Dr. Sue Wang. She's the medical director of the viral hepatitis programs at Cooperman-Barnabas. She also served as a fellow for the CDC, and she testified at Thursday's ACIP meeting, not only as someone who treats patients with hepatitis B, but also as someone who's living with the disease. Dr. Wang, thank you. Welcome to the show. We really appreciate your time. I want to just get first your reaction to this new recommendation.
So, as somebody who watched the proceedings and was part of testifying, and just seeing the live happen, the vote happen live, it was very disappointing and honestly very upsetting, because we have had such great success with the vaccinations, and we've reduced hepatitis B rates by 99% in children since we've had the universal birth dose for since 1991, and we haven't had any new data to show it's unsafe. There hasn't been any new study that's been alarming, and so this really kind of came out of nowhere, and we didn't expect this. So, and as somebody living with hepatitis B, it's especially upsetting because I wouldn't want anybody else to have to go through what a lot of us have gone through with hepatitis B, living with hepatitis B, in terms of having to worry about liver cancer, shorten life with cirrhosis, and worrying about spread of it, especially when it's so easily prevented with just one vaccine.
Yeah, and I wonder if you could walk us through what the real risk is to infants, and from your medical and personal standpoint, what that evidence is, data-wise, as to why these vaccines work at keeping the disease really almost eradicated.
Yeah, so the hepatitis B is extremely contagious. It's actually a more contagious virus than even HIV, and it's through blood, so it's not through skin touch or respiratory droplets. So it does require blood, but I think people often don't think about how there can be microscopic traces of blood on certain things through cuts and wounds, and kids getting scratches or getting bitten by siblings, or caregivers that might be taking care of a baby's cut or a wound and have a cut themselves, or maybe through a nail clipper that's been used by other people too. So these things can happen, and I'm actually a living testimony of that having happened, because I believe I got hepatitis B from my grandparents, who came to take care of me at a month of age. And they, at that point, that didn't know that they had hepatitis B as well. And my grandfather later did die of liver cancer early on. And that happens a lot. There are a lot of caregivers or people who come in and out of a baby's household, and they don't know their status, or it could be a visitor, it could be another caregiver at a daycare center, and not to make people feel panicked about it, because I think the whole point of this is, if we vaccinate the whole population, it doesn't matter, because once you're vaccinated and you're immune, you're protected for life. And so that's given an entire generation of kids 30 years of experience of people who are completely protected from hepatitis B and don't have to worry about it. But by rolling that back, now all of a sudden we all have that concern of oh, am I exposed? Is there exposure happening? And so that's concerning, because we made such great strides, and it doesn't make sense to undo that. And I think one thing for everybody to remember is that there is always a choice. There was never not a choice. So people could always have opted out. And our data shows that we've had this universal birth dose. It's not 100%. Even when you offer it universally, I think in New Jersey, we're at 70-something%. So already parents are choosing not to do it, and nobody's taking away that choice. But when you no longer universally recommend it, you're going to even have bigger gaps in care, which is an issue, especially in New Jersey, because we are such a diverse state. And So hepatitis B is definitely an issue that we should be concerned about.
Yeah, we definitely have a unique landscape when it comes to that. But I wonder, too, if we start to see other states nationally drop this birth dose, what's the risk there? What's your concern about that on a broader scale?
So what's going to happen is this is a virus, and viruses don't discriminate. They don't care about state borders. They don't care what color you are, what language you speak. And when you have more people living with the disease, you're going to have more transmission. And so when you look at the strides we've taken and the rates of hepatitis B having just really come down nicely, over time, we're going to see it start coming back up. If we have fewer people vaccinated in general, we're going to have more transmissions. And I think during the meeting, there was a lot of people talking about overall that it's very low risk. And certain groups have Hep B, other groups don't. But I have to tell you, a lot of people show up with Hep B and they have no idea how they got it. They don't have any of the traditional risk factors. And that's something to remember, that we should think of disease as something that affects the general population, not just certain groups. So I think it's important. It's a time to, not let go of the gas pedal at this point, but just keep doing what we were doing, and we were doing a great job. So let's continue to be leaders in vaccinating, and I think that goes for kids, but also adults. The CDC has recommended universal vaccination for adults too, because adults actually over 30 are the ones who often haven't been vaccinated. So it's a good time to do your catch-up vaccinations as well.
Very quickly, before we let you go, your message to parents who now worry because of information that has come out from the CDC, varying information, that there are, quote unquote, too many vaccines for children. I certainly hear it in my circles. What's your message to those parents, and why the dose is so important within those first 24 hours?
So in general, vaccines, we have to remember, are really a sign of progress. There are a lot of diseases that we don't have vaccines for, but the ones that we do have vaccines for, we're very grateful for it. Our kids don't have to worry about measles and Haemophilus, things that not that long ago, pediatricians were treating babies in the ER who couldn't breathe or had tetanus, and polio, all these things, we have forgotten about that. For Hep B specifically, in terms of why within the first 24 hours is so important, we have data showing that the sooner the baby gets it, the less likely they become infected. And so that timeliness is really important. And we've actually tried before doing it at a week of age, so after the baby was delivered, or even a few days. And even that, the difference between a month, 2 months to birth, actually reducing it down to just doing it at birth within 24 hours, it's a huge difference in terms of preventing transmission. So there is a reason behind it. And I think people kind of start looking into the history and the details. There was a good reason why we actually do recommend it being given within 24 hours.
Dr. Sue Wong, thank you for lending your insight, your expertise here. We really appreciate your time.
Thanks for having me.
Support for the medical report is provided by Horizon Blue Cross Blue Shield of New Jersey, an independent licensee of the Blue Cross Blue Shield Association.